It really is still an unsettled market. I think we look at uncertainty in a couple of different dimensions. Obviously is the whole health reform initiative, the movement toward meaningful use on the part of providers. Some are doing quite well with that, some are not. And 2012 will be the year where we begin to see probably some fairly significant failures or admissions that they're behind in that space. For the payers, tremendous pressures now around ICD-10, around information security, around possible penalties and security issues around breaches. So for them, a very challenging market. And then for consumers as well. I mean, consumers don't really know what to expect under reform. I think they have a set of expectations around how healthcare is going to change, and I don't think those are always accurate. And I think consumer expectations are pretty high right now, and the vast majority of them might not see everything that they're expecting. So consumer uncertainty in the provider and payer spaces, difficulty in executing, shortages of budgets. For some, that'll sound like business as usual in health, but it is going to be another very chaotic year. There are, we think, several key technologies that are going to be important as you move forward. And I think the big challenge here is how do you make plans for this uncertain future? You're not really sure where your management is going to end up from an accountable care perspective. You're not quite sure how partnerships are going to line up. You probably will change the way that you interact with physicians. Consumer expectations are changing. So, we have all this change in the marketplace, and yet, IT still has to submit a budget. They still have to have an innovation plan. They still have to move forward on projects. So there are, I think, some key areas where we see consistency across all of the different options. Clinical analytics is a very kind of strong, significant driver for future change that you're going to have to fund almost no matter what else you do. Mobility, security, both very important as we try to get better engaged with our physicians and our patients. Cloud from capabilities and an operating cost perspective. So even given the uncertainty of the times, there is a fairly clear path for most IT organizations with a set of initiatives they can focus on from an innovation perspective that'll pay dividends almost despite the chaos in the marketplace. So you have to do the have-to-haves before the like-to-haves. Reform, meaningful use, ICD-10, they're going to consume a tremendous amount of resources in the next year because they have to, because organizations have to comply. Where there is extra money for innovation, again, analytics and mobility seem to be two areas that are very consistently popping on the top of the list. And also cloud. I need to do a better job of running my data center. I need to do a better job of engaging my physicians and patients. I need to do that all in a secure way. And ideally, I'll do smart things with the information I gather by running those programs. Analytics, the ability to gather, to aggregate, to organize, to act on information. That probably is going to be the critical success factor for many of these institutions moving forward. If we can't become a more data-aware, data-driven organization, if we can't create these actionable analytics, we're probably going to be acquired by someone that can. I think for so many now, it's hard. It's hard to be upbeat. There's so much to do. Resources are so constrained. But I'd suggest to them that opportunity always flows from chaos. That the market you're in now is changing. That change is making it difficult. That change is making it challenging. That change though is also creating opportunities. It's creating opportunities to deliver better care. It's creating opportunities to be more financially viable as we do that. It's creating opportunities to go out and treat new patients in new markets that we could never address before. So I think you have to stay upbeat, you have to be positive, you have to be focused on the opportunities out of chaos. It would be easy to go be Eeyore in today's environment and believe that no matter what we did, we were being followed by this dark cloud. And I've certainly met my share of folks that seem to feel that way, but But the ones that are winning, the ones that are doing great work for great institutions really are seeing an opportunity in change here.